Every triage call comes with a certain level of risk. It is always the triage nurse's responsibility to ensure that the patient is put on the appropriate path to care, whether it is at home, at their physician's office, or the emergency department. In this lesson, we review a scenario of a couple of calls from a concerned mother of a 6-month-old. She will reach 2 different nurses that will illustrate how a telephone triage nurse is able to reduce risk. Let's meet our patient. 6-month-old Georgia was born at 38 weeks gestation. Her mother had an uncomplicated pregnancy and natural childbirth, choosing no medications. The APGAR score at 1 minute was 8 and 5 minutes was 9. Baby Georgia weighed in at 6 pounds 13 ounces and was 19 inches long. She is now 13 pounds and 26 inches long. She is up to date on all immunizations and has no ongoing health issues. She is babbling and giggling and is right on track with all her developmental milestones, according to her pediatrician. Georgia's mom is calling nurse triage to ask if she needs to be seen in the emergency room tonight or what she can do for her symptoms. Georgia has had a mild nasal drainage and congestion and a non-productive dry-sounding cough for about 2 weeks. Tonight, she developed a fever of 101 rectally. Mom says Georgia seems more tired than normal, her naps are longer, and she is not as playful, but is still giggling and sitting up some during the day. Georgia, who is normally content to play with her toys on the floor, is much clingier and cries more often in the last few days. While there are no obvious major red flags from this assessment so far, the nurse should always be thinking worst-case scenario. First, let's talk about some obvious red flags that the triage nurse should consider when talking to parents with children that are too young to verbalize their own symptoms. Fact: did you know that newborns are a very high-risk age group, especially during the first 7 days of life? According to Barton Schmidt's newborn protocol, over 90% of under-referrals that result in a serious adverse outcome involve newborns. Another fact from Barton Schmidt newborn protocols: newborns with serious chronic diseases may look good at birth, but abruptly change during the first week of life. Another fact: symptoms of serious illness in newborns can be very subtle. Poor sucking, sweating during feedings, change in muscle tone, decrease in activity, change in color, or a sudden change in feeding behavior, to name a few. The nurse needs to ask, what is normal for your baby? Which may be a hard question since the baby is so new. But parents start to know their infant's behaviors and patterns very early. What is different? What is your baby doing right now? Keep in mind when triaging a newborn, there are some serious diseases that will present with subtle symptoms at first. Bacterial sepsis with fever or hypothermia, very weak and shock, or congestive heart failure with poor color and sweating during feeds. Herpes simplex can cause clusters of vesicles. Meningitis, which can be viral or bacterial. Severe dehydration from inadequate breast milk production can cause weight loss, sunken anterior fontanelle, possible stroke during the 2nd week of life. Supraventricular tachycardia can cause prolonged crying, sweating during feeds, tachypnea, and tachycardia. Focus on symptoms. Is your baby acting sick in any way? Does your baby have any symptoms? Remember that new parents may think that only a cough, cold, and runny nose are symptoms of an illness. What's your baby's temperature? Has your baby's color changed? How is your baby's breathing? Don't just stop at asking this question. Go into more detail. Talk the parent through counting respirations. Have them lift the baby's shirt to expose his abdomen and look for retractions. Have them look for nasal flaring, skin coloring during cough and without coughing. Ask about duration. How long has your baby been like this? While Georgia is not a newborn, she is still an infant, and the nurse should be familiar with milestones of a 6-month-old and assess for any subtle symptoms of illness that the parent may not have picked up on. Georgia's mom decides to call the nurse line on Friday evening, just to make sure she was doing everything she should. Here is what was said between the nurse and mom. Hello. This is a nurse returning a call. Did you call about your baby?
Yes, I think she's okay, but I just want to be sure.
Okay. Tell me what's going on.
Well, she's my first baby. She has had a runny nose and a little cough for a few weeks, but now she has a fever and is fussier than she normally is.
Any other symptoms?
Well, she's taking longer naps during the day, and the last few days I thought it was normal at her age, but now she tends to wake up during the night at least once crying, and it's hard to get her back to sleep.
Yes, all babies are different, so this could be normal.
She has never had a cold or been sick before, so I'm not sure how to know what is normal and what is not normal.
If she's eating okay, wetting diapers, and consolable when she cries, then she is okay. Just be sure to follow up with your doctor on Monday. It could be a cold and nothing to worry about.
Well, okay, thank you.
No problem. Good night. Let's take a minute to go over some of the areas that should have raised red flags as risky when you heard them. Number 1. The nurse did not identify herself by name and did not confirm the patient's name, spelling, or the practice. If this note was faxed to an incorrect practice, it could be considered a HIPAA violation. Number 2. The nurse did not follow any standardized protocols or ask any assessment questions about the infant's symptoms. Number 3. The nurse did not gather a health history on the infant. Number 4. The nurse did not pick up on the mom's statement that the infant was sleeping more during the day and waking crying at night. Number 5. The nurse did not review symptoms to watch out for or give any home care advice. This infant very well could have had a bacterial infection, such as pneumonia, and a delay of care of even 24 hours could make a huge difference in the outcome for this baby. The goal of nurse triage is to work with patients to develop a plan of action, get them to the most appropriate care in the most appropriate place and by the safest route. All medical professionals practice their jobs with risks. Nurses are no exception. The teletriage nurse must be sure and practice as a prudent nurse would do in a similar situation. In teletriage, negligence is defined as a failure to communicate significant information in a timely manner to the physician or patient. Pop quiz! When does the relationship between patient and nurse begin? Answer: the moment the nurse answers the phone. Our nurse, when talking to the mom of baby Georgia, overlooked many necessities that put her at risk for harming her patient or delaying care. Nurses should be careful to take the time to elicit enough information to make an informed decision. Ask questions, lots of questions. If you do not understand what your patient is telling you, keep asking questions until you do. Do not assume. Don't be sloppy. Nurses must be vigilant on the phone, gathering information such as past medical history, medications, allergies, and chronic diseases. These all factor into the nurse's decision as to the safest disposition for her patient. Back to baby Georgia. Her mother is calling again tonight. She reaches a different nurse, and their conversation goes like this. Hi, this is Linda. I'm a registered nurse returning calls for ABC Pediatrics. Who am I speaking with, please?
My name is Susan, and I'm calling back about my baby Georgia. She isn't acting right.
I'm glad you called, Susan. I can help you. Is Georgia breathing okay right now, and is she stable so I can ask you a few questions to be sure she's in our system correctly?
Yes.
Thank you. Please spell her first and last name and state her date of birth.
Georgia Smith, GeorgiaSmith, and she was born on April 3rd, 2017.
What is your relationship to Georgia?
I am her mother.
Thank you. Which doctor does Georgia see?
She sees Dr. Jones over at ABC Pediatrics.
Thank you for confirming that information. Tell me how I can help you this evening.
I called earlier and the nurse I spoke to said his symptoms were normal, but I'm worried. She has a cold-like symptoms for a week, and she now has a fever and is sleeping more during the day, but up crying more at night. I'm just not sure if I should take her to the emergency room or what to do. I'm worried because she hasn't ever had a cold or been sick before.
I see. So tell me more about the cold-like symptoms you were noticing.
Well, she has some nasal drainage, but mostly she's congested. She's coughing a little bit, but mostly I'm worried about her clingy behavior and the crying episodes.
I understand. It is concerning when babies are too young to verbalize how they feel and what is wrong. I'm glad you called. I can help you. Let's talk about Georgia's eating and drinking. How much does Georgia normally drink per day, and how much has she taken in so far today?
She usually takes a 6-ounce bottle every 4 hours, and then I give her 1 jar of baby food 3 times a day. So far today, she has taken in almost her normal amount.
Great. And how many wet diapers does she normally have a day?
I usually change her diaper with every feeding, and it is wet. That hasn't changed today.
It is important that I get a brief health history on Georgia. That will help determine if she needs to be seen today or can safely wait until the office opens. Tell me more about Georgia. Does she have any health concerns?
No health concerns. She's normally pretty healthy.
When is the last time you checked Georgia's temperature, and which route did you take it?
I checked her temperature rectally about 2 hours ago, and it was at 101, and so I gave her some Tylenol.
Nicely done, Susan. Does Georgia seem to be less clingy and crying less since you gave her the Tylenol?
Yes, and she's a little bit more playful now. She's sitting on the floor playing with her toys and giggling at her brother.
That is good. Now tell me more about Georgia's cough. How frequently is she coughing, and does it sound dry or congested? And does it wake her up at night?
The cough is not frequent, maybe 3 times an hour, but it does sound more congested today. When she wakes up crying, she coughs more and it sounds wet, but she doesn't get anything up.
When she coughs, do her lips or face look bluish?
No, that doesn't happen.
How about when Georgia takes her bottle? Does she have to pause like she needs to catch her breath?
No, she's drinking well still.
You mentioned that Georgia is clingier and crying more often. Tell me more about that behavior.
She cries like she doesn't feel good, but usually when I pick her up, she stops. At night, when she wakes up crying, I have to go into her room and pick her up and rock her back to sleep. That usually takes 15 minutes or so.
It sounds as if Georgia will need to be seen by her pediatrician tomorrow because of the new onset of a fever and the crying episodes. I can give you some home care to help ease her symptoms tonight, and I will go over some symptoms that would warrant a trip to the emergency room tonight. I want you to call her pediatrician first thing in the morning to make her an appointment. Can you do that?
Yes, I can watch for those things and will call. Thank you for your help.
The nurse then reviewed home care advice and additional symptoms to watch out for. I'm happy to report that in our scenario, baby Georgia was seen by the pediatrician the next day and was diagnosed with an ear infection and started on antibiotics. This case demonstrated the importance of taking the time to properly introduce yourself and ask all the right questions. The first nurse did not confirm any of the patient's information and did not ask the appropriate follow-up questions to get to the real cause for baby Georgia's symptoms. This left the mother still concerned and left a lot of room for risk of baby Georgia having more complications if her ear infection had not been treated in time. Fortunately, the mother chose to call back, but this is not always the case. That is why it's important to follow all of the steps on the first call to reduce risk as much as possible. Thank you for visiting TriageLogic's Learning Center. Check back soon for the next installment in our risk series.